So today we are going to discuss our next part of the systemic assessment. So today we are going to discuss about the breast assessment, right? So breast assessment is very important nowadays because in every women we are having the risk of like a breast cancer. Okay, so it's all over now, so every person should be doing the breast examination. Okay, so every patient when we are starting the breast examination, we have to greet the patient like, hi, I am today going to perform breast examination. So whether you have done it before, and the patient will say no, I have not done like that. So we will be explaining them why you are going to do and what is the risk of not doing it. Okay, then what we are going to do, we are going to make the patient to sit down. Okay, and we are going to make the visualize the area of the breast. So here you can come and we will be exposing the patient, and there it's very important to make the if it is like a female patient and a male patient is examining, and if the female patient is doing on the male a patient, so there should be a chaperone present with them so that it can make them comfortable. Okay, and now let's begin with the examination. So number first, what we have to do, we have to always look for the breast symmetry. Now how it is looking, what is the normal color of the both breast. Okay, and any kind of asymmetric condition is there, any dimpling, any kind of retractions. I have all the way I have explained you in the class what is dimpling, any kind of inside depression or any kind of retraction. If there is any tumor or something, that will pull the skin inside, so we have to see in all over the breast. Okay, so if the symmetry, if the color, or if there is no lump, there should be no edema, so that things we have to inspect on it. Okay, then as I told you about the depression or any kind of retraction, so that is going to pull your skin, so you are going to see that. If you are not able to see, you have to examine it from the angle to angle, whether any kind of abnormal lump or any mass you are able to see in this, so you have to note it down. Okay, so now with the you can say you have inspected, so now you will be inspecting the nipple. So as you all know, the nipple is normally you can say outward. Okay, so they are always everted. Okay, so you have to check for the nipples for the eversion. Then you have to look for the areola in the side of the you can say in the just below the nipple. So any kind of abnormal discoloration or any hyperpigmentation of that area is there. And I need to explain you a little bit more about that. If any kind of blue discoloration in this area, if you are able to see blue discoloration in the sense when the venous pattern you are able to see on the both breast. Okay, so that means the female can be pregnant. Okay, so in that pregnant women there will be some dilation, and you will be able to see some venous patterns of the vessels, right? But if the female is non-pregnant and still there is some dilation in the breast area, so that is quite abnormal, so we should be addressing that to the doctor. Okay, so then we have to look for any discharges coming from the breast or not. Okay, because in the pregnant woman it is common, we can have little bit of the discharge, but we are never going to expect it in the non-pregnant female. Okay, so now after the general examination, now what you're going to do, you're going to have some maneuvers. Okay, but what you have to do first, you're going to make the patient sit for you and little bit leaner. So I'll be showing you on the our volunteer. So what you're going to do, you're going to make the patient sit down like this. Okay, and you're going to make the patient to lie down a little bit bending over you have to do. Why I'm going to do this? Because with this the breast will be pendulous, and it will be in the front it will be moving, okay, against the chest wall. So with that, any kind of dimpling or any kind of retraction if on the skin region of the breast, you will be able to notice. So one maneuver is we have to make the patient lie down so that the breast should be like a pendulous and we can feel any kind of dimpling. Okay, then now what you're going to do, you're going to make the patient to lie down. Okay, and in the lying down position we are again going to do the you can say palpation of the breast, so that we can check for the any kind of abnormalities which is present. Okay, but for that maneuvers, as I told you, first maneuver is to lie down lean down a little bit forward, right? Then the next maneuver will be, you will be making the patient to keep their hands like this over the head, so that there should be the equal movement of the breast. As I told you, when the hands are down, so they are little bit pendulous. So when we are going to move it like this, so with the muscle you can say pulling, the breast will be going up down. So you have to see that whether the breast is going above in the both of the breast, it is moving up. Otherwise, if there is some muscle or there is some cancer, so those breasts will be retracted, they will not be able to move equally. So you have to see that equally whether they are moving or not. Okay, that is number first maneuver. Then one more maneuver is you have to ask the patient to keep their palmer's hand like this. Okay, so with this again the pectoralis muscles will be contracted, and again, okay, so again the breast will be like a started to like what to say having any retractions or something. So you can see any dimpling or any kind of depression in this area we have to look for. That is the second maneuver. Okay, then the next maneuver what we are going to do, we will be making the patient to lie down so that we can see any kind of, because when the patient is lie down, so in that condition the breast tissues will be against the chest. So with that we can like palpate it on the hard surface, and it will be very easy to find any kind of lump. Okay, so that's all with the maneuvers. So now we are going to do the like a next palpation of the breast, and that we will be performing in the next part. So thank you so much. Stay tuned for the next video.